So good morning, everyone. I'm excited to talk to you all about wellness and inclusivity as a leader. There will be some portions where I will ask you to talk to me, so it's going to be exciting. I apologize for my voice. Believe it or not, it sounds better than it did Monday, where I was talking in a whisper. That would not have been fun for today. All right, so our objectives for today will identify the characteristics of an effective leader, resources to help you evaluate your own strengths as a leader, how you can create a positive team culture, understanding the importance of wellness for yourself as a leader, and then utilizing the wellness-centered leadership model to integrate leadership and wellness as a physician leader. So we're going to start off with a story in 3 acts. So we will first start off by talking about leadership so that I can make sure we have a strong foundation for how to ensure you have those skills that you need. Then we'll transition to wellness, and then we will marry those 2 topics. So Act 1, leadership. What's it good for? So, okay, we're going to start off with SpongeBob SquarePants. And to be fair, I talked to my residents on rounds today, and I was like, so just a quick pop culture check. You guys know who SpongeBob is, right? And they were like, yes. And I was like, okay, good. So I can put this picture in here. So what we're going to do is actually think about a leadership skill for the Bikini Bottom. So these are our characters that we see in SpongeBob. And I would like you to tell me, if you were going to be starting on an inpatient team and you had to choose who your attending was going to be, who would you want your attending to be? Who has those leadership skills that you feel like could get you done with rounds at 12 o'clock and not 5 p.m., huh? Ooh, Squidward. Why Squidward? No nonsense. He said, let's go. Let's talk about business. I don't want any jokes. I don't want any laughs. We're just going to go in and we're going to get things done. Anyone else have any thoughts on who they would like to lead them? Sandy. Okay, why Sandy? Positive. So she's going to get things done, but she might add a little positive in. Squidward probably isn't going to give you words of affirmation. He's not going to tell you when you're doing a good job, but he'll tell you when you're messing up. But Sandy will actually give you both of those things, and you'll feel like she actually cares about what you're doing. So that's kind of the high end of the scale. Who would you not want to be your leader? Who would you dread? Like you would look at that list and see who you're working with. You're like, oh gosh, not again. Gary. Okay, exclude Gary. Gary, we won't. Okay, Gary doesn't count. Okay, all right. Huh? Mr. Krabs. Why Mr. Krabs? All right, so Mr. Krabs is just worried about what is going to benefit him. He isn't worried about making you a better physician. He isn't worrying about leading the team to get you where you need to go. He's worried about Krabby Patties. So excellent job, guys. Look at that. SpongeBob is helping us learn about leadership. So what makes a bad leader? And I'm actually starting off with the bad leader trope as opposed to the good leader. Why? Because you probably remember that leader that wasn't great more so than you remember the awesome leader, unfortunately. So what makes a bad leader? Thoughts? Lack of insight. So maybe they're not able to recognize their own weaknesses. And so they keep focusing on things that make the team dynamics not work so well. What else? Yes. Poor listener. Oh, goodness gracious. Don't you hate it when you're talking to the attending and then you get to the end and they ask you the question you already answered? And you're like, pretty sure I said that. But yes, their troponin was 0.5 today. Yes, that's correct. Anything else? Ooh, so not making people feel valued. So when you're the medical student on the team and the attending's like, med student 1, med student 2, and you're like, I have a name, it's not med student. So not feeling valued or a valuable member of the team. Excellent job, guys. So I wanted to include this quote because I was talking to someone that I admire greatly, and he was telling me about how he got into this leadership role, and now he actually had no desire to be a leader. But he was talking to a colleague of his, and he was discussing, or I guess I should say, complaining about the things that were wrong in their division and saying all the things that could be improved upon. And they challenged him. They said, you keep complaining about the things that are wrong. Why don't you try to change them? And so this Gandhi quote kind of challenges you to step outside of the, this is broken, this is horrible, and actually encourage you to be that change that you want to see. And so I hope I can kind of charge you to take on that. So how do you become an effective leader? First and foremost, you must know yourself. Going back to insight. Yeah, I think you got my slide deck ahead of time. So you must know who you are in order for you to be an effective leader. Why? If you know your strengths, you know the things that you can actually lean on when you need to help move a team forward. If you know your weaknesses, you know when you need to call in that assistance or that extra person to help you out in that moment. So I wanted to talk about a few resources that can be helpful in when you are actually reflecting on what are your strengths and what are your areas of improvement. So this first one on the top right, so this is unconscious bias. So we've been talking a lot more about that recently and recognizing that there are social stereotypes that exist, that in our brain, we are making these associations with groups of people and assigning certain characteristics that aren't exactly true. And this happens to all of us. Why? Because back in the day when we were hunter-gatherers, your brain needed to be able to quickly see that's a cat, it has a mane, that's a lion, run because it will kill you. Got it, go, awesome, wonderful. You might have never actually seen a lion in real life. You may have never actually interacted with one, but you know you need to run when you see the lion. So your brain is geared to make these quick associations without you having to actively think about it. So these unconscious biases oftentimes run counter to what you actually believe or what your conscious biases are. So with that in mind, these unconscious biases will usually kind of come up when you're in a state where you aren't actively able to put the brakes on. So when you're multitasking, which I would say is not really a thing you can do. As a millennial, I cannot multitask and I will accept that, and that's okay. Why? Because when you're focusing on this one task, you can trick yourself into thinking that you're multitasking, but really you're just doing that automatic thinking. You're not actually actively engaging with it. The second is when you're overwhelmed and overstressed. Why? Because you don't have time to process and think through that unconscious bias. You just need to go. So there's an implicit association test that was developed to help us ascertain what those unconscious biases are. And essentially it relies on the fact that the human brain likes to take two separate concepts, and if they're similar, we quickly link them or we quickly make that connection. And so it literally flashes up these two words and it asks you, are they connected or not? And based on your response time, it's able to ascertain if you possibly have those unconscious biases. So let's shift gears. Now we're going to talk about the Clifton strengths. And so I think this is wonderful because it actually challenges you to focus on what are your top 5 strengths as a leader. And instead of saying, these are the things that you're not good at, so you should probably improve upon it, it's like, no, these are your strengths, and here's how you can make them even stronger. Here's how you can use them to your advantage. And so this is another tool that you can use to help ascertain how you're doing. Next is the Myers-Briggs personality test. I did not realize this is just a personality test. I think when I was reviewing and I read that, I was like, oh man, so this is just a personality test? They made me feel like this was like really insightful. And it was going to tell me how I talk to people and how I interact with them and influence my life. Kind of like how I thought about horoscopes when I was a teenager. So the Myers-Briggs test actually takes these 2 dichotomies or 4 different dichotomies, and it gives you one of 16 personality types. This is often used in the business world when they're building teams so they can see how well are people going to interact with one another based off their personality type. And then the last one I wanted to mention was emotional intelligence, especially as a leader. As some of you have already kind of hinted at, when you are leading, you need to be able to see the people around you and recognize where they are. You also need to be able to recognize when you are having emotions that may not help the team move forward. So if you're getting angry or upset about something, being able to recognize that anger, identify why you were having that emotion, be able to temper it. So in that moment, you can get the job done and maybe come back and address whatever that issue was. And then being able to kind of be empathetic and recognizing that those that you're working with are humans. They make mistakes, things happen. So making sure that you give them that benefit of the doubt, so to speak. So these are resources to help you ascertain what your strengths are as a leader. So I can't leave you guys without a little bit as far as how can you create this recipe for leadership success. So we'll talk about psychological safety. We'll talk a little bit more about team building in the wellness section. I will briefly introduce radical candor. I'm going to restrain myself because Dr. Bonheur is going to talk about feedback. So I will we're just going to do a little bit, I promise. And then we will also talk about the growth mindset versus the fixed mindset. So psychological safety. So this is also a new buzz term that everyone's talking about, like, ooh, you got to have a psychologically safe environment when you're teaching and learning. What does that even mean? So what you're saying is you're creating an environment where people feel like they can voice their opinions because their voice matters. that what they say, if they say the wrong thing, it's okay, because the purpose or the goal of this environment is to make everyone better. And we all have something to learn from one another. So Amy Edmondson, when she actually first developed this concept, she was doing a research project and she was looking at hospital teams. And her premise was that hospital teams that make less errors have better team dynamics. Okay, that tracks. But however, when she took a closer look, what she found were hospital teams that made more errors actually had better dynamics. Oh, hold on, what do you mean? So the people that were messing up the most actually worked better together? She took a deeper dive. What she found were these teams where they were reporting more errors felt more comfortable voicing those errors. So you therefore had an increased reporting of the errors that those teams had. Why? Because the goal of the team was to make everything better. And you can't get better if you're not talking about those errors. And so that's how she uncovered psychological safety. So this grid kind of helps us look at performance standards and psychological safety and the way that they interact with one another. I would argue that most physicians are going to fall in the performance standards that are very high. So I'm just going to focus on that side of this diagram. So at the bottom right, you see the anxiety zone. This probably brings you PTSD from when it was like your first day as a medical student and you're standing in front of the attending getting ready to present and you're like, oh my gosh, I think I wrote everything down that I was supposed to do and I'm going to say every word exactly the way that I wrote it, because if I don't, then they're going to yell at me and it's the worst day ever. Or when you accidentally go into the wrong door in the surgical suite and you get yelled at by the anesthesiologist, may have been there, may have done that. So all that to say is you don't feel psychologically safe, and literally your only focus is trying not to get in trouble. You can't learn because you are in fight or flight. However, if you create an environment where you have that psychological safety, that's where learning happens. Why? If you look at children, how do they learn? They make mistakes. Then they learn from those mistakes. So they don't make those mistakes again. So we have to create an environment where people feel comfortable making mistakes so that they can learn from those mistakes. Also, we're physicians taking care of patients. There's not a lot of room for us to make the same mistake multiple times without intervening, unfortunately. So how do we create psychological safety? So first, you must make it an explicit priority. So I feel like this is a little awkward. You're like, all right, team, we're gonna get started. This is a psychologically safe environment. Get excited. Everyone's like, what does that mean? What are we gonna do? I don't understand. Instead, clear expectations. Why? When people know what's expected of them, it's easier for them to meet those goals, so to speak. So you don't have to explicitly say psychological safety if you feel like it might be a little bit gimmicky, so to speak. Facilitate everyone speaking up. So everyone's voice is important. So as a inpatient attending, I've got this large group of learners that I'm with. We're walking down the halls, and there are times where not everyone talks. So one of the games I like to play is called Price is Right. It's not really called Price is Right, but that's what I call it. Where essentially I pose a question where I'm like, all right, guys, so we see that we've taken care of this patient with bronchiolitis. What is the one evidence-based treatment for bronchiolitis? And then we go around the circle. Everyone must give me one answer. One answer. You don't have to explain it. I don't need justification. I just need you to give me an answer. Why? So everyone gets a chance to voice their opinions. Everyone gets to hear it, and everyone is participating. So even for that learner that might not feel as comfortable saying things just when I'm asking questions, I get a chance to hear their voice, and hopefully they realize it's okay to speak in that setting. Next is establishing norms for how failure is handled. So this is where I model. This is where I own my mistake. So if I make a mistake on round, I own it. If I say the wrong thing and I am teaching my residents the wrong thing and someone's like, hey, Dr. Burroughs-Ray, actually, that's not quite what it is. I'm like, you know what? Thank you for correcting me. Guys, ignore what I just said. This is actually what we should be doing. Excellent. Next is creating space for new ideas. So when someone has an idea, say thank you. That's an excellent thought. How can we incorporate that? And then last but not least, embrace productive conflict. I tell my team when we're on rounds, your job is to not let me mess up. Don't let me hurt anybody. Don't let me teach anything that's not true. In addition, your job is to be a physician. And one day you're not going to have me there to talk to you about a situation. So when I ask you for your plan, please tell me your plan. I'm coachable. I can be convinced. And if your plan is better than my plan, let's do your plan. All right. So feedback. All right, guys, I promise this will be short. Just brief, stay with me. So radical candor. So this is actually a concept from the business world. And they discuss how you can how you can maximize the feedback that you're giving to your team and how to do so in a manner that actually affects change. And so Kim Scott created this framework, and she has a book which I would highly recommend if you feel uncomfortable with feedback. And she says there are two components that you need when it comes to feedback. One, you must challenge directly, and the second is you must care personally. If you are challenging directly and caring personally, you have achieved the goal of radical candor. You are able to give feedback that is specific, timely, humble, and that actually helps your learners or your team members move forward and gain the skills that they need. However, you can see that there are other quadrants for when you don't quite meet that. And so I just wanted to harp on two of them, which you have likely seen. And I'm going to talk about ruinous empathy first. Why? Because this is often the quadrant we find ourselves in. So we care personally. We really want that team members to succeed. We really believe in them. We think they're going to be an amazing physician, but we also value that relationship. And we want them to like us because we're humans. But we don't like when people don't like us and they're a member of our team. So instead of taking the time to tell them, hey, on your presentations, I noticed that you skipped the physical exam and your problems were a little vague. I think we could do something to help make them a little bit more specific. You just say, hey, you know what, Tommy, you're doing a great job on your presentations. Keep it up. And so the next time they go to rotation, they're going to do the exact same thing. And hopefully someone at some point is going to give them the feedback you could have given them 2 months ago, a year ago, and that they could have changed and improved upon. So by prioritizing your feelings and that relationship and not prioritizing them getting the skills that they need to be an amazing physician, you actually end up harming them. The next category I want to talk about, and then we'll move on, is obnoxious aggression. So this is where you are challenging directly. You are very clear about exactly what it is that you want, but you don't care personally. So I don't care that you had to go pick up your daughter in the afternoon. We're going to round to 6 p.m. tonight, guys, because I don't have to be home until then. Or, as we've more commonly seen and have kind of moved away from, this is pimping. This is where you have an attending who is just going to ask you question after question after question, and they don't really care if you get it right or not. Why? It's about making them feel smart because they're the attending and they know everything. So all that to say here, those are categories that you would like to stay away from, and ideally staying in that radical candor where you're challenging directly and you're caring personally. And then talking about the growth mindset. And so I thought this was interesting. I stumbled upon this when I was a chief resident. And so there's kind of these two mindsets. You have fixed mindset and growth mindset. So for a fixed mindset, you say, I can't do math. I'm horrible at math. I just can't do it. It's impossible. It's not a thing. Or I can't run. That's not what I do. And so you take those statements and you believe that they're facts. They're unchangeable. You cannot change the fact that you don't do math well or that you don't like to run. However, with the growth mindset, you recognize the fact that when you encounter those challenges, it's actually an opportunity for growth and you can improve those skills. So for me, just outside of medicine, mine was I can't run. I can't run because I can't breathe when I start running. I can't, it's impossible. My undiagnosed asthma starts acting up, y'all. And so at some point I was like, you know what? People keep running these 5Ks. Man, I want a 5K. They give you medals, and they give you a t-shirt. I want that. I can do that. And so suddenly I changed from I can't run to, okay, I can't run long distances just all at once. I should probably just run shorter distances more frequently. Okay, all right, I can do that. And then you get the excuse to buy new shoes because I need new shoes to run. That's the problem. You got to go to the run store so they can fit your shoes. Then you're able to actually run appropriately. So all that to say is turning that statement of I'm a failure into I'm still learning and improving. So recognizing that you have those opportunities for growth. All right, so leadership as a physician. Don't be house. That's not a good leader. All right, PSA done. Moving on. So just talking a little bit, I just wanted to briefly review and highlight some leadership roles that exist in academics. Why? Because as a student, as a resident, you will encounter each of these roles except for chief resident unless you choose to. With that being stated, each role that you have subsequently, you're going to have more leadership opportunities. Therefore, if you get these skills early, it's going to make those next steps easier. Why? Because in medicine, we assume you're going to be a great teacher. we assume you're going to be a great leader. Why? Because you saw me. You got to see me be an excellent teacher and an excellent leader. So you're just going to model and repeat what I do. Ignore the fact that not all attendings may have the skills that you would like to emulate and repeat as a leader. So all that to say is take into account these skills because you're going to use these at every level as you get to becoming an attending physician and practicing independently. With that being stated, I'd be remiss if I didn't actually highlight what are some of those leadership qualities that you should have to create that positive culture. So some of these things we've already talked about. So including making sure that everyone's voice feels like they're heard, informing, making sure that your team knows all the same information that you know. So there's no feeling that you're withholding information. Inquire, asking questions. When something goes wrong, when I say, let's discharge this patient at 5 p.m. after their KUB comes back, as long as it's normal, and then the following morning, they're still here. So instead of saying, why didn't you discharge my patient? I told you to discharge them. What happened? Hey guys, I noticed that Mr. So-and-so is still on the list. Do you guys know what happened last night? Okay, all right. So he actually, even though his KUB was normal, he started vomiting. And so we couldn't send him out because we were concerned about a different, okay, all right. That's totally reasonable. Wonderful. Developing, helping to move or help your learners to get to that next level. And then recognize, showing appreciation and gratitude. We're humans. We like it when people tell us that we're doing a good job or when they recognize when we're going above and beyond. All right, so Act 2, wellness. Pizza party not included. So Dr. Jackson knows this joke because once upon a time, I was very young in the wellness game and I was real excited. I was like, yo, let's do wellness. And everyone was like, another pizza party? And I was like, no, not a pizza party. It's more than that. Like we're actually gonna like improve wellness by doing things that aren't just like giving you free pizza. And so I hope by the end of this section, I'll have changed your perspective on wellness and that it's not just a pizza party. So first and foremost, what is wellness? So wellness is a state of personal fulfillment and engagement that leads to joy in practice and ultimately a connection to why one went into healthcare in the first place. So as I mentioned, you're going to advance in medicine and you're going to get further from that why. Think back to the personal statement that you wrote when you wanted to get into medical school, to that interview when you were trying to get into medical school with the medical school committee admissions person, and you had to articulate to them why you were so passionate about being a physician and why there was no other role in healthcare that was going to fit what it was that you wanted to do to impact people, health, or whatever it may have been. What are these? What's this? What's this? Airplane oxygen mask, yeah. Anyone remember what they tell you? I mean, no one listens to what the flight attendant says at the beginning, but anyone maybe might have listened. And do you remember what yes. Yes, so they say, if we suddenly lose cabin pressure, these masks will drop from the ceiling. Please apply your mask first before assisting any other people. Why? Because you can't help nobody if you can't breathe, because you might be unconscious at that point. So you must first make sure you apply your mask. In leadership, the same goes for wellness. In order for you to lead your team and actually promote their wellness, you got to take care of yourself, my friends. So why is this important? Because it starts with you. If you're the leader, you're going to set the tone and you're going to be the one to guide what happens for the rest of the team and what your team is going to emulate. And studies have actually shown that a leader's own personal level of burnout, professional fulfillment, and self-valuation predicts their rated leadership behavior scores by team members. So how their team members perceive them actually correlates with their own level of burnout. Whoa, that's crazy. All right, so my team knows when I'm burnt out. I already know that. So I just give the caveat of like, hey team, I know it's my first day here, but it's actually day 8 for me because I just finished up 7 days across the street and I got 2 hours of sleep because my daughter thought it was gonna be a party last night. So today's gonna be rough. We're gonna make it through. We're gonna have a great time. So just expect my level of energy is gonna be low. Maybe tomorrow I'll have a rebound and we can be able to like have a little bit more fun. And then last but not least, I thought this was very interesting, that leaders' evaluation of sleep adversely impacts their team members' sleep behaviors. Think about it. Think about the leader that brags about, yeah, I don't need to go to sleep. I just had a Celsius last night and I'm an hour 56 of no sleep. Yeah. So you're like, man, I guess I don't need to sleep either. That's not important. And so as a result, no one's sleeping. No one's doing their work very well, and you're all going to crash and burn. Sorry. I didn't mean to target anyone with the Celsius. I just said that because my husband drinks them. So that's the energy drink that I am most aware of currently. I've heard that Monster's fallen off. Is that true? Okay, we'll talk about that later. All right, so leadership wellness toolkit. So in my mind, if we're talking about any skill, leadership wellness, It's my goal to hopefully give you something that you can take with you at the end of this presentation. So the purpose of this section is to actually do that. We're going to talk about communication, mindfulness, and self-care. So we're going to start off with mindfulness. Why? Because I feel like this is really nebulous and confusing, and everyone says be mindful. And I'm like, what does that mean? All right, so mindfulness. So it is paying paying attention in a particular way, paying attention on purpose and in the present moment, and not being judgmental. So it's listening to the words that I'm saying right now during this presentation. You're looking at the slides. You're not thinking about what you're going to have for dinner tonight, the grocery store, the shoes you need to take back to the store, or the fact that you need to buy cookies for this party that's happening next week. No, you are present here in this moment. You are ignoring all of those thoughts. So this is how I think of mindfulness. This to me helps me better conceptualize what mindfulness is and what I'm supposed to be doing. So I imagine myself sitting in a room and I'm trying to listen to this record. I don't have records, but like I'm listening to a song, probably on Spotify, right? This is not me because I'm not cool enough to have tattoos. So as I'm sitting in that room, I'm trying to listen to this record. Inevitably, this is what happens. Oh, that's me in the room, in case you were wondering. I'm like, oh yeah, what are we gonna have for dinner tonight? Yeah, we just bought that new cookbook. Like, oh, there was that salad. Yeah, that's gonna be really great. Or I'm like, oh gosh, is there a Grizzlies game tonight? Why is this important? Well, my husband works in the Forum. When there's a Grizzlies game, my husband is at the Forum. And me and my daughter, Emery, are holding it down. So that helps me prepare for that night. Am I gonna be solo or am I gonna have help tonight? Or I think about my calendar. I'm like, oh God, how many meetings do I have tomorrow? I don't know. Oh, did I miss a meeting yesterday? Oh gosh. Or I think about all the projects that I have that I'm really excited about. I think about shoes. I really like shoes, guys. We'll talk about that later. But like online shopping, these things bring me joy. And then also my daughter, Emery, because she's probably making noise in the background now. And she's like, Mommy, you're not paying attention to me. What are you doing? So all that to say is oftentimes when we are trying to focus on that one thing or being mindful, our brain tends to interject with these different things. And so the goal of mindfulness is to be able to recognize when that thought is trying to interject and to just say, no, we'll worry about that later. I'm going to pay attention to this presentation because it's amazing. All right, so mindfulness for the leader. How do you do this as leader? So the first step is hit pause. So when your team member asks us, hey, I've got a question, saying like, oh yeah, that's great. I got to go see this patient right now, so I'll talk to you later. You actually stop, look at them, and you listen to what they're saying, as opposed to being on your computer and being like, yeah, okay, cool, sounds great. Because you're not listening. We know that you're not listening. Next is decreasing your cognitive load. As you probably noticed, as you move forward in medicine, you are constantly thinking about certain things and you're juggling multiple things simultaneously. And so try to take some of those things off that mental cognitive load and actually write them down. So making a weekly to-do list, prioritizing the tasks that are most distracting. So that thing that you know you need to do and you're like constantly perseverating over it because you haven't do it, just get it done. And suddenly it's easier to focus on your other tasks. And then asking for help when you feel overwhelmed. So being able to recognize when you need some assistance. And then remembering your team member as a person and not a complaint. So when someone comes to you to complain, you're like, oh gosh, here we go again. Here's Katie, another complaint. Ugh. It's always something. Actually listening to Katie and hearing what she's saying, because there may actually be something that is helpful or that can improve the team dynamics just by stopping and listening to what she's saying as opposed to blowing her off. So here are some ways that you can promote your mindfulness. There's a 5-minute gratitude journal. It takes less than 5 minutes. And so it's nice, it's one page, and you start off your day with like, what are 3 things that would make today awesome? It's great because suddenly you find yourself during the day prioritizing those 3 things. So then you come back to it at the end of the day and you review, you're like, I had coffee this morning. I spent time, I had dinner with my significant other. You're like, yes, I did wonderful things today. And then it ends by having to reflect on one thing that you're grateful for that day. So reframing or reshaping your perspective and focusing on those things that are positive. All right, so we're gonna practice some mindfulness. We're gonna do some box breathing, yay. Okay, full disclosure, I might have gotten this from my Lamaze class, but hey, it works in all situations. So what we're going to do is we're going to breathe in for 4, hold, breathe out for 4, and then hold. We're going to do that a couple times. All right, here we go. So we're going to breathe in for 4. 1, 2, 3, 4. Hold for 4. 1, 2, 3, 4. Exhale for 4, 3, 2, 1. Hold 2, 3, 4. Inhale, 1, 2, 3, 4. Hold, 2, 3, 4. Exhale, 2, 3, 4. Hold, and let it go. Okay, you guys probably think this is mumbo jumbo, but what I will say is I had a learner that was he was on the like high performance, and I think he didn't feel very psychologically safe with me. That's okay. I will accept that. And he was very anxious on rounds. And I noticed this every day. So we did some box breathing one day before we started rounds. Best day ever. And I tried to nap afterwards. And I was like, how was rounds today? He's like, man, that was a lot better. And I was like, yeah, I got you to relax and focus on what we were doing in this moment and not have you focus on all of these other things. So just something to take with you in your back pocket. If you ever feel like you need to take a moment, do some box breathing. So next thing we're going to talk about is self-care. And so I think this is where people are like, so this is like Parks and Rec. They're like, treat yourself. So you're gonna have like some cupcakes and fine leather goods. You're gonna go to a spa for a day. Like, yeah, that's self-care. Okay, so it's not the one day out of the year where you like actually prioritize yourself. It's something that you should be doing intentionally on a daily basis. And it is a basic human need. So it's something that we should be addressing on a daily basis. It's restorative. It brings you joy. If it does not bring you joy, it is not self-care. If you hate basketball, you hate organized sports, everyone's like, oh my gosh, the Grizzlies are so great this year. They got playoff games. I got an extra ticket. You should come. You're like, yeah, I guess I'll come because you have an extra ticket and it's a playoff game. So I'll go. And you're miserable. It's horrible. It sucks. You're just like, oh my gosh, why did I do this? You're going to feel worse at the end of it. So you actually did the opposite of self-care. So it's just as important to know the things that bring you joy as the things that don't bring you joy and to avoid those things. And it's individual. So each of us define this differently. So here are some ideas for what that can look like as a leader. So first and foremost, taking a day off. So if you're off, be off. It's okay. Don't look at the email. Someone else is in charge. They will take care of all the things. I encourage my residents when they're off, don't look at the chart. I got this. I promise. I'll take care of the patients. When you come back, they should still be alive. If I'm on the adult side, sometimes things happen, all right? But we will do our best to take care of them. Just be off, it's okay. The next thing is being intentional. Plan what you're gonna do on your day off. And if it's just, I wanna sit on the couch and watch Netflix, that counts because you plan Netflix. You're like, you know what, I heard season 6 of Love is Blind is out. That's what I'm gonna do on my day off. It's probably the same thing as the other season, so I don't know how much enjoyment you might get from that, but that's okay. Self-care is individual, whatever brings you joy. Next are weekly or daily activities. Remember, I mentioned this is something you're doing on a daily basis, not just one day out of the year. So that could be that 5-minute journal I mentioned, or it could be kind of that routine, something that you enjoy that you enjoy and look forward to every day. Maybe it's that morning cup of coffee. Some of my colleagues are like, I gotta have my coffee. Like if I don't have my coffee, it's a bad day. Like hands down, there's no recovering from it. I personally I like a good cup of tea, especially at night, just like helps me like relax. This means the day is ending and my work here is done. Okay, it's never done, but you get the feeling. Or what can you do to actually help promote that team building? So maybe it's having a brag board, ordering food. That's like my favorite thing because wellness for me equals food for the most part. So for better or worse, most of my learners get free food from me because it means that I'm well and I'm trying to encourage your wellness by giving you food. And then the last thing that I would really, really encourage you to do, especially as you continue in medicine, because the creep is real, is being able to separate work and home, being able to turn work off and be present at home. Why? Because the individuals that are at home are going to appreciate you being present as opposed to you being on your computer, especially if you don't need to be. So it's interesting because I had never heard about this before. And then I realized that I had allowed the creep to occur. So I become a chief resident. I had been in Memphis for 4 years. It was me and my dog, Peppa. She's a Shih Tzu Pomeranian mix, beautiful little lap dog. And I was like, you know what, Peppa? You deserve a backyard. You've been here 4 years in an apartment. We're going to rent a house. Yeah, awesome. So we rent a house, got a backyard. And I'm like, I'll open the door. I'm like, go forth, Peppa. You may run outside. And so what I realized is that before, when I lived in an apartment, when I got home, that walk with Peppa was my way for turning work off. So when I came home from that walk, I was home and I wasn't thinking about work anymore. Because I didn't have that switch, when I was at home, I was doing work, y'all. All I did was have the laptop open, doing more work. It was not good at all. So all that to say is think about what it is that helps you recognize that work is off and now I'm at home. The next thing I want to mention is just communication. Why? Because we know how important communication is. We play the game telephone as kids, and we know what happens on telephone. Sometimes the message gets lost. So I just wanted to briefly touch on the few things that you can do to promote and improve your communication. One is conflict resolution. It will happen. You'll be responsible for mediating it. It's not fun. It doesn't get easier the more you do it, but you start to learn the best way to assess that. So always listen, talk to both sides before you start making judgments, getting those facts. And when you do deliver that corrective feedback, recognize that it needs to come from a place of wanting them to improve and that you don't want them to feel like it's punitive, and having clear next steps for how you're going to move forward from that conflict and being able to continue that teamwork. The next is the debrief. Oi, we don't do this very well in medicine, which is crazy. Think about the situations that we're in. We see people die. We see people at their worst. We see moms that are grieving for the child that they thought they were going to have, but their child encountered severe injuries during birth. And so now they may have HIE or cerebral palsy. And now they're having to reconcile the fact that the child that they thought they were going to have is not the child that they're going to take home with them. But we don't talk about those situations. Instead, we tell you, take those feelings, put them in a box, walk them, and move to the next patient. Maybe you'll deal with them at some point. And so I'd argue debriefing is actually something that we should probably improve upon. And so with that being said, I kind of wanted to talk a little bit more about debriefing and kind of give you a brief tool that you could use to help you out as you're thinking through that. And so it's only 3 parts. Look, I told you it's going to be brief, very brief. So the first part is just reaction. So talking to that individual or that group, like if you're in a team setting, say, hey guys, yesterday was rough. It was a difficult day. How do you guys feel? And being okay if there's silence. Because sometimes we need silence because it gives us a chance to think. So once you get a chance to see how everyone's feeling, then start kind of reflecting on what happened. Why? Because oftentimes if you're that physician who is leading that code and that patient doesn't make it, you assume it's because you didn't do everything you could have done. You did something wrong. Or if it is your patient who ends up coding, what did you miss? How could you have prevented your patient from dying? So by actually asking these questions, you can help ascertain what it is that people are feeling and hopefully reframe it so that they understand that all of their actions, all the things that they did were the best for the patient. And there wasn't anything that could have been done differently that would have likely changed that patient outcome. Dr. Jackson has been that for me when I had a very difficult patient outcome when I was brand new attending, and a patient who I had just seen had talked to him, talked to his wife. There's a code blue overhead, and it's that patient. And I remember dreading seeing him and his wife because he made it through the code, but I dreaded seeing them. Why? Because it was my fault. I saw him that morning. I made the plan. I said what we were going to do for that patient. And I remember going down to the ICU to visit him, and his wife was at the bedside, and I saw her, and she looked at me and she said, thank you. Thank you so much for everything that you've done. I'm so happy that I get to see you. And I realized that 1, it's not about me, and 2, even if I didn't feel like I was doing everything that I could do, that patient and their family trusted me, and they felt that. So all that to say is we oftentimes don't realize that unless we actually have these conversations. So it's important that we have these conversations. And then the summary, when you finish that debrief, kind of focusing on what are the things that we've learned or gained from that experience, so that hopefully we don't encounter it again. All right, Act 3, the final act. Dun, dun, dun. All right, so we're going to utilize theory, the wellness-centered leadership model, to help you guys become awesome leaders. All right, so this is the model. Yay! So it's a beautiful pyramid. Wonderful. So there's a base. So that means you have to have this first in order for you to get up to the top. And so our base is caring about people always. Then you need to cultivate relationships and inspire change. So this was created out of the fact that they recognized that the landscape of medicine was changing. Physicians were starting to feel like they were cogs in a wheel because medicine was becoming a business as opposed to an art. So as a result, the focus wasn't on the relationships you built with patients, the care that you provided. It's how fast could you see patients, how many patients could you see, how many RVUs could you generate. And so what they recognize is that you were removing individuals from that intrinsic desire, or those intrinsic motivation that they had to be a physician. So how do you reconnect them to that why? So first and foremost, care about people always. So I have included pictures that are mine because I feel like this actually sticks a little bit better if we talk about things that are real. So what I first want to talk about is this bottom right picture. So this is Kat, this is Sega. These are my 2 supervisors during my 2nd month of intern year. I night float at our very busy pediatric hospital. They sent us a 5-page email document telling us the expectations for the month. I was overwhelmed, afraid, and I was like, oh God, they're gonna know that I'm not supposed to be here because all the things they're asking me to do, I don't know if I can do them. All that to say, those two individuals were amazing leaders, and they made each and every one of us that were a part of that team feel seen and feel important and feel valued, even if we weren't sure of ourselves and our skills as physicians. Subsequently, we became the night team family. We met up for lunch, or we met up for dinner at least once a month, every month after that for the next 3 years, y'all. These individuals were my support system. They saw me through breakups, through good times. Lindley came to my wedding. We were at Jess's baby shower. This became my family. And this all started with them caring about me when they didn't have to. Next, I wanted to talk about giving credit and demonstrating gratitude. So at the top picture here is me and my team from Regional 1. We got our jerseys on. And so this is actually spurred by my resident who I was working with for that month. So his perspective was his job as a resident was to be coach. So he was the coach, and that's how you refer to him. You refer to him as coach, and he owned that role. And so he was constantly promoting and encouraging the interns, the students, whenever they did a good job, or if you forgot to tell them something on rounds and he needed to add it during rounds, he'd be like, oh, I'm so sorry, Tommy, I meant to tell you this earlier, but this is additional information that I got. As a result, he created this environment where everyone felt comfortable participating, and I felt included too because he let me be the GM. So we wanted to honor Coach by wearing jerseys on this day. Still a little disappointed. He was supposed to have a visor and a whistle and a clipboard. He failed. And I said, if you really need them, I would have gotten them ahead of time so you could have them because this was very important. And then the last thing I wanted to add is kind of being curious and respectful, empathetic, and understanding. So this picture here is from my first month as a brand new attending. I was working with 2 residents that I had actually trained with because I stayed at the same institution that I trained at when I started as a faculty member. And I was working during my birthday month. And it was actually my birthday. And we had already planned to have team lunch. I was going to buy lunch for everyone because, you know, like I told you guys, that's my wellness. And I'd actually brought some like cupcakes too, just to be like, hey guys, it's actually my birthday too. Here are some cupcakes. And so we were sitting and we're chatting. And next thing I know, one of the residents comes out with this cake. And they're like, happy birthday, Dr. Burroughs-Ray. I was like, whoa, how'd you guys know it was my birthday? I didn't tell you guys. What is this? But just as much as I cared about them as individuals, in return, they saw me as a human and as a person, and they took the time and the effort. She made this chocolate raspberry ganache cake, y'all. Great British Bake Off level. Just saying, just saying. And she didn't have to. So all that to say is it's twofold. If you demonstrate that you care about people, they're going to reciprocate that as well. The next is cultivating relationships. So not only do you need to care about them, you need to build those relationships so that they feel comfortable. And in doing so, helping them succeed in the team. So first and foremost, respecting their choices. So we'll start at the top left here. So this is actually my night float team. And I continued the tradition I learned from my night float family, where after a week of nights, you celebrate with breakfast because you earned it. We're going to go hang out. We're going to get breakfast, not have to answer a page, not have to go see a new admit or talk to the ED. We're just going to like enjoy hanging out with one another. And so this was us getting a chance to actually go eat breakfast at sunrise and just hanging out and building those relationships, which is great because nights are stressful. Like you don't know what direction you're gonna be pulled in. And so you wanna feel like you can lean on the person that you're working with. Next is giving options and identifying what sparks joy. So we're gonna go to this bottom right-hand corner here. So the note card method. So when I'm on service and I start off, I hand everyone a note card. And I say, I need 2 goals. I need 1 educational goal, 1 thing that you want to work on while we are working together that is going to help you be an amazing physician. The second thing is a wellness goal, 1 thing you want to prioritize during our time working together that will help you be well, that isn't leave work on time, because that's not wellness. That isn't finish all my notes, that's not wellness. It has to actually be something separate from work. So then when I meet with them, I actually give them feedback about those goals. And I start with the wellness goal. Why? Because that's more interesting to me. And 2, I actually get to learn a little bit more about them besides the presentations that they give me on rounds. In addition, this is our resident wellness committee with our PD, and we got a chance to present and talk about what we were doing. So once again, building those relationships, helping my wellness champions succeed and be able to be in a position where they're presenting at national meetings and we're talking about what we're doing. And then this last picture, so this is me and all my co-chiefs when I was an internal medicine chief resident. And this one is especially significant to me. Why? Because we started out as chiefs in fall of 2019. And chief year is usually really busy at the beginning because you got recruitment, and then the spring is beautiful because recruitment is done. You get to enjoy life. However, spring 2020 was very different from other springs. And suddenly, we found ourselves having to recreate a schedule, having to be a triage nurse for residents, where they were calling us with symptoms and trying to figure out whether or not they had COVID, helping them navigate the health department and get testing. And it required us knowing what each other's strengths were so that we could fill those gaps. I remember when we literally had to do multiple things that were pretty heavy lifts, and we divided ourselves into two teams naturally. Those that did schedules went to the left. Those that did not do schedules went to the right. I went to the right, the far right, because I don't do schedules very well. But because we already knew each other's strengths, we already knew where to go as far as how to achieve the goals that we needed to achieve. And then the last one is inspiring change. And so this is the one that I would argue is probably the most difficult or feels the most overwhelming, but I would argue that's not the case. So you want to model the desired change, and I kind of want to focus on the resident wellness committee that we have here with our internal medicine residency that I helped create when I was a chief resident. I was like, oh, I'm going to do wellness, and I want residents to lead it. Yeah. And my program director was like, cool, go for it. And I was like, okay, so I guess we're going to do this. So I was like, let's get a committee. So I got people together and I was like, all right, so what do you guys want to do? And I had one resident, he was like, okay, I got a list of things. There's one thing I want to do, like that we absolutely must do, hands down. I want coffee. I need coffee in every workroom. If you give me coffee in every workroom, my wellness will be immensely better. So what do? About Keurigs, about K-Cups. It's pretty simple, but it was very impactful. So suddenly we took the suggestion of our residents and we actually implemented it, and they're like, whoa, 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 whoa. Did you just listen to us? Did you just give us the thing that we asked for? Okay, all right, maybe this is a thing. Maybe you're actually going to change what we're doing here. Additional things that we did is we had our, our wellness dogs. They're not wellness dogs. What are they called? Therapy dogs. Except I'm not supposed to call them therapy dogs. There's another word that they use for it. I don't know. Needless to say, essentially, these are dogs that have specifically been trained to be present in the hospital setting and to kind of provide that therapy to you as far as like tactile touch and having a dog. So we had a noon conference where I just had them bring dogs to noon conference. It was great. It was wonderful. There may have been pizza, okay, but there were dogs too. So it wasn't just a pizza party, guys. And then I just wanted to highlight one more thing, and then I won't kind of belabor this. But so this bottom picture here. So this was when I was an associate program director of the MedPeds program, and these were our incoming chiefs for the year. I helped to recruit these chiefs when I was a MedPeds chief resident. So I was there during their interview days, talking to them, encouraging them to come to our institution, and they chose to come here. Then I got to train with them, and I got to be their chief when I was their internal medicine chief resident. And for me, it was very much full circle for being able to recruit them to our institution and to be a part of our residency program, and then to be a part of the leadership team to help them hit the goals and gain the skills that they wanted to as residents. And so it was just very impactful to be able to be a part of all those things for them. All right, so let's put this all together. Like, you talked a lot about all these things, so how does this all work out? So you know I like food, right? So the way I think about this is, you've got a dinner party. And so one of our good friends, they would host these dinner parties where essentially you would just show up and you'd cook. They'd have all the ingredients, they'd have cookbooks open, you choose a recipe, and everyone just cooks. And so you've got 10 to 15 people in the kitchen, each working on a dish. Maybe they're working on chopping, maybe they're working on dicing. And ultimately, you get this wonderful plate. So when I'm thinking about being a physician wellness leader and promoting that inclusivity, this is what it is. It's giving people the skills and the tools they need to be able to apply their strengths so that the team can be the strongest that it can be and achieve its goals. So lessons I learned, that means we're getting close to the end. So just because it isn't my idea doesn't mean it's not a good idea. Oftentimes it probably is a good idea. Admitting your mistakes, bring your authentic self to work. So if you know me, you know I like shoes. And so one day last week we had cool shoes days and everyone wore the cool shoes and we took a picture. Why? Because I like shoes. Your teammate may be your co-leader in the future. So this is Dr. Yanuszewski. He was actually an intern my very first month when I was a brand new attending. This is him and my daughter, Emery. When we went to our Saturday clinic with my pediatrician because she likely had an ear infection, which she did. And he walked in the room and I was like, hey, Dr. Yanuszewski, I didn't know you were here. He's like, yeah. And so suddenly I know the doctor that's taking care of my child and we're talking about the Grizzlies. Why? Because he knows my husband works at the forum. And so we already have that relationship. Always assume positive intent. And don't forget to support and celebrate. So this is celebrating Dr. Jackson, whose inauguration is SMA president, woo, because he's my mentor. And so I was there to support him and to let him know, hey, I appreciate all the things you do, and I'm excited. All right, so there was a study that was done by JAMA, and they sought to figure out what are the qualities that physician leaders have, or physician attendings have, that make them amazing attendings. So they surveyed 10 institutions, had them recommend their top attendings, and they ended up with 289 individuals that were nominated. They whittled that down to about 30 individuals, and they interviewed them, and they interviewed those people that worked with them. And these are the qualities that they pulled out as far as being consistent across each of those individuals. I bring this up why? A lot of these are the things we already talked about. So connecting the dots, that being a good leader, promoting wellness, and being that physician that's centered on wellness will help you be an amazing physician leader. All these things are interconnected and they're interrelated. And I would argue if we spent more time talking about wellness, we'd probably be better physicians at baseline. I did want to end with this quote because honestly, this is probably the most impact you will have without even recognizing it. Your patients will probably be the ones to voice this to you more than anyone else. People will forget what you said. People will forget what you did, but people will never forget how you made them feel. So when I went to that ICU room to go see that patient and I saw his wife at bedside, what she remembered is how I made her feel when I first met her, and she was telling me how her and her husband met in college when he was teaching karate, and she took karate for him, and they fell in love. That's what she remembered when she saw me, not the mistakes that I made or that I felt like I made. So these are my references, and then I want to say thank you. So that's my family, that's Jake, that's my husband, that's Emery. Emery's saying, great job, you guys can be amazing leaders. She believes in you, you can do it. And then, I mentioned feedback and how it's really important to me. I would really love and appreciate if you put your handy dandy phone to that QR code right there and give me some feedback. Why? Because I like to make sure that things that I'm saying are actually helpful. And if it wasn't, please tell me so I'd never repeat it again. All right, thank you guys so much. Any questions? I'm happy to answer them.